As the state of Maryland is seeing a consistent uptick in hospitalizations, state officials are working even harder to get the shot in more unvaccinated Marylander arms. And joining us now to talk about the state's Don't Wait, Vaccinate campaign to promote childhood vaccinations for the back-to-school season is Deputy Health Secretary Dr. Jinlene Chan. Thank you, Doctor, for joining us today.
Thank you for having me.
All right, so you all started this campaign because of a significant decline in childhood vaccines, not just COVID. So specifically, what are you guys seeing?
So, what we saw is that early on in the pandemic, many of the doctors' offices closed. We shut down the state early on. And so parents were keeping their kids at home, schools were closed. And so we had a significant drop in the number of vaccines that were being administered. And we're talking about the regular vaccines like measles, mumps, whooping cough, and chickenpox. And it was down almost 50% compared to the year before in 2019.
Oh my goodness.
So while we've seen those numbers come back up, we do believe that there's a number of kids that are still behind on their regular vaccines. And so we really want to encourage parents to call their pediatrician or their local health department to get their kids vaccinated against the routine required vaccinations.
Yeah, and there's a danger in waiting. What are some of those dangers?
Well, COVID-19 is absolutely still top of mind for all of us. So we would encourage all parents who have kids who are 12 and older to get COVID-19 vaccine. But, some of the other illnesses that, we hear about, but maybe don't see as much of, like whooping cough and measles, they're still floating around. And so we really want to be sure that all of our kids are protected against those so that we prevent potentially having to face a measles outbreak as has happened in other states.
Mm-hmm, most definitely. And so to encourage students and parents to get the COVID-19 vaccine specifically, you are offering an incentive. Tell us about that.
Right. So, earlier this summer, we launched the VaxU scholarship campaign. And so kids who are vaccinated at least one dose between 12 and 17 are eligible to get a $50,000 scholarship. And, I think the drawings happen, I believe, weekly. And so we are looking to encourage kids to get vaccinated, but also, be able to, provide them support for their future and if they choose to go to college.
Mm-hmm. Possibly a win-win there. So any advice for hesitant parents or anything else you'd like to add?
Vaccines have been shown for decades to be very safe and very effective. And so we have had so much experience with measles vaccine, flu vaccine, chickenpox, and those are diseases that we don't see anymore. It's interesting as a pediatrician, even in my training, I never saw a measles case, and I was very fortunate. But we are seeing, because people are concerned about some of these vaccines, that they're not getting their kids vaccinated. And it's in those populations that are at the greatest risk of getting measles. And the same with COVID-19 is that what we're seeing in the hospitals right now, what we're seeing in terms of people getting infected with COVID-19, it's primarily people who are unvaccinated. And so, even with kids, there is a risk not only of getting infected, but then of getting severe complications. And so with this new Delta variant, we really strongly encourage everyone to get vaccinated.
All right, Dr. Chan, thank you so much. And to learn more, folks, you can head over to covidvax.maryland.gov. Thank you for your time.